celebrating the Menstrual Hygiene Day every year, 28th May. So, and also finally, we are discussing about the AFSC application. So, these are the main topics we will be covering today. And we have a joint director, PSSSP, RKSK and Family Planning. So, let's invite our joint director, Dr. Janardhan, sir. Over to joint director, sir.
Interactive లేదు మనకి. Okay, good afternoon all the RKSK program officers, medical officers of PHC and adult health counselors. Tomorrow on 28th May, we are celebrating Menstrual Hygiene Day. So this is the main program tomorrow. I request all the POs to communicate the message to all PHCs, all ANMs, all ASHAs. Everybody should participate and everybody should participate in this event and educate all the people regarding menstrual education. And I request all the POs and medical officers to take up rallies and other activities of IEC, distribution of posters, and tomorrow exhibit all the IEC material, and you can go even to media also. So the IEC is very important. Still we have dark in menstrual hygiene. So we need to disseminate the menstrual education in our society. The IEC is the important, and I request all the medical officers to conduct in every PHC, in every hamlet, villages also. Mainly the taboos of menstruation, which are still running in our society, should be made aware, and the people should be educated regarding the menstruation, as it is a normal process and it's a physiological process. So I request all the medical officers to communicate all the ANMs and ASHAs for tomorrow's program to make a grand success and disseminate the information of IEC and health education regarding menstrual hygiene. And disposal of these used menstrual pads also very important, and this should be in a biomedical manner, and so safe disposal of menstrual pads is also very important, and this is also to be spread in the community. I request all the POs and medical officers to stress this important issue tell everybody to make a note of this and tell all the ANMs and ASHAs regarding the biomedical disposal of this pads. And finally, HMIS updation is also very, very important, as we are working very hard and doing all the job and not displaying ourselves in the government's portal. So we should, the hard work should be reflected in the HMIS reports. So everybody should know the HMIS, opening of HMIS portal and updating the RKSK work, all items, that is IFA distribution, AHBC clinics, and the client load, menstrual hygiene scheme. Everything should be reflected in the HMIS portal. So I request all of you to take note of all the things and make a grand success of tomorrow's program. Please participate and share good photos of the program. Thank you. The details will be shared by our consultant Ravi Kiran. Thank you. Kiran, continue.
Thank you, sir. So before that, before moving to the menstrual hygiene, we'll discuss about the RKSK program in briefly, because I think there may be a newly recruited medical officer from UPSCs and also PSCs. So for them, we need to have a brief introduction about the RKSK. So what is RKSK? RKSK is a national health program launched by Government of India, Rashtriya Kishore Swasthya Karyakramam for adolescent health exclusively. Yeah. So this was launched on 7 January 2014. It's a very recent program comparatively to other NHM national programs. So under this, we have a 6 themes. So nutrition, which is talking about the nutrition, like, hemoglobin is very, very important to growth and development of, for the adolescent, and also the balanced diet. So sexual and reproductive health, as we know that during this period, secondary sexual, development will be there. So and mental health which is a very, very important component in our RKSK program, injuries and violence, substance abuse, and finally non-communicable diseases. So these are the 6 thematic areas which we need to cover under RKSK program. So we have a different type of interventions in the RKSK program. So one is facility-based approach, that is adolescent-friendly health clinics. That is what we are insisting all the medical officer, UPS and PSCs to conduct AFSs at every Friday for girls, Saturday for boys exclusively under RKSK. So model AFSs we have at a DEAC level, district level. That is like, we have a 26, but we, as per on record, we have mentioned 24. So, and we have a teleconsultation facilities in the AIMS Mangalagiri. And coming to the next intervention based, that is school-based approach. As we know that WIPS, weekly iron folic acid supplementation program, every Thursday we will be administering tablet IFA to all the adolescent girls, boys in the school. That is, we have a target beneficiary of 25 lakhs in school girls and in school boys and girls. And out of school, we have providing for out of school adults and girls 5 lakhs. So coming to the menstrual hygiene, so tomorrow is that, as we know, celebration of menstrual hygiene day. So we have a 13 lakhs beneficiary in school. Out of school, we have 5 lakhs. So total, we have 18 lakhs 15,000 beneficiaries under menstrual hygiene scheme. Under this scheme, we are providing the sanitary napkin, sanitary pads free of cost to all the adolescent girls. Especially, we are giving for the in-school adolescent girls so far. So during this, we should this procurement and supply will be done by the education department. Earlier, we have distributed that sanitary napkins to the adolescent girls through ASHAs and ANMs. So last couple of years, we have given this to the education department and women child department. Now education department is procuring and supplying the all the sanitary napkins to the adolescent girls, especially in school. So we should monitor the usage pattern, and also we should create awareness among the schools, like how to use for the first time users, and how to discard. So everything we need to provide the knowledge to the adolescent girls. We have AH counselors, especially in the aspiration districts like Kadapa, Karnal, Vizianagaram, Visakhapatnam. So take the support of the IH counselors in the field, and also you can take the support of ANM Ashas in order to implement the menstrual hygiene scheme. Under the school-based approach, we have a school health wellness program. Everybody knows that two teachers were trained under school health wellness program by the CRT during the COVID time virtually. And we have a total ambassadors, like health wellness ambassadors are called as the teachers. So they should provide education on, they have undergone 11 thematic curriculums for their students. Like, they need to discuss these themes during their parent teacher assembly meetings. So they should utilize the platform to transform the education, all the health related issues, and they have to discuss with the children. And coming to the community-based approach, as we know that peer educator program, again, it's a very unique program designed by the government of India. So peer educator program, like, as we know that this teenage group is engaged group. It's very tender. They won't, listen to everybody. They only will have a communication dialogue with their own age group. So because of that reason, government of India designed a very unique program called peer educator program. So as per this program guidelines, 1,004 peer educators, we should select 1,000 population by the ASHA, and they should undergo 6 days of residential training by the medical officer and CHOs in the community. So far, it has not been properly implementing in the Andhra Pradesh. So as we know, there are so many gaps in implementing this program. So that is the reason we should focus on the peer educator program. So under peer educator program, we are, distributed the waistcoat and cap to all the peer educators selected and trained by the CHOs and MOs. So those are, like, they have to sensitize the community in order to, using the peer educator kits. Like, there are 6 types of materials which you have given to all the peer educators in order to conduct weekly one session with all the their peer groups. So each peer educator has to formulate 15 to 20 members in the group, and they have to discuss the various issues which we need to encounter during their meetings. So again, this peer educator will play a crucial role in order to bring all the adolescent issues to the model AFSCs or AFSCs in the field. So coming to the adolescent health and wellness days, these are the monthly once activities. So celebrated at school level and sub-center level by CHO or supervised by the medical officers. So during these health wellness days, like, they have to provide the counseling services to all the adolescents located at schools, and they have to check the BMI, anemia testing. So everything they have to conduct during the adolescent health and wellness days. They should celebrate these days, like, they should more engage with the adolescent in order to provide any quiz competitions, electives, any other skits, any competitions. So coming to the out of community-based intervention, we have WIPs and MHS. So we have a school-based approach and community-based approach commonly for implementing the WIPs and MHS. So this is a brief introduction on the brief interventions under RKSK program. Yeah, coming to the menstrual hygiene scheme. So menstrual hygiene scheme, tomorrow we will be celebrating the menstrual hygiene day, 20th May. That is, every year we will be observing the 28th, observing this menstrual hygiene day, as it is it's transformed to the global movement towards creating a period friendly world. Last year we have a thematic implementation program, like, we have selected the theme like period friendly world. So the day is dedicated to breaking the taboos and raising awareness about importance of good menstrual hygiene management. So tomorrow we should have to provide some activities. So every year we used to conduct some activities like public information campaigns as rallies, marches by the adolescents and other key stakeholders, engage with the PRIs, local sarpanch or MLAs, other local leaders for dialogue on this issue and seeking their support towards better the bottlenecks, and publicize key information in the media, including social media. Distribute IEC materials. So we already designed a few IEC materials which we have already circulated with all the POs. So kindly take from them, and again we will share all the IEC related to menstrual hygiene. No worries at all. And we need to distribute IEC materials, pamphlet, takeaways, reading materials, display posters, banners. Yeah. So last year we have designed on one MHS banner. So now we are not sharing that banner because its theme, again we need to change the theme and edit the date. So last year we have celebrated like 20th May 2024. Now we can change, we can edit that banner like 2025. It's a simple task. So social special counseling session at the AFSs, as well as we know that medical officers and the UPSC, PHC, you should provide a special counseling session to all the adults and girls tomorrow, and organizing adolescent health and wellness days. If possible, tomorrow we can organize and the distribution of sanitary napkins to the adolescent girls. So now the schools were closed, so it will not happen. But if possible, if any school, any residential institution is offering that such kind of activity, please kindly participate in that activity and engage through social media platforms such as Insta, Facebook, and Twitter. So all these series of activities which we need to perform tomorrow, and we are expecting the this message has to reach entire Andhra Pradesh through our MOs, CHOs, and ANMs. So coming to the next. Yeah. Please wait a minute. I'll share the one PPT like regarding HMI separation. So I think it is visible to all. So so far we have discussed about the RKSK and its strategic interventions. So now we will discuss about the data elements, different data elements we have under RKSK in the HMIS. Yeah. So first one at subcenter level, at PHC level, we have M11, M13 between actual our data element number is M12 at state level. So we can say at the AFSC level, it's between M11 to M13. So these are the data elements M12. Under M12, we have adolescent health. The main heading 12.1, it says about adolescent friendly health clinics. From 12.1, it will start like, friendly health clinics. So number of AFSCs registered in adolescent friend, and out of number of received clinical services. This is about AFSCs. So registration and the services. It talks about registration and services. And coming to 12.2, coverage under MHS, Menstrual Hygiene Scheme, GOI supported. So here at PHC level, the medical officer supposed to enter only at 12.1 to 12.1.3, which means that AFSC. So every month you have a separate client load. So you just, put the number. Just when you need to enter the number, how many are registered boys, how many girls have been registered, out of how girls registered received clinical services and counseling services. So that data you need to enter at the PHC level. So please ignore the 12.2 like coverage under MHS menstrual hygiene scheme GUI supported. You need not to enter any data here because it's an activity at subcenter level. The people who is working at subcenter level has to enter that data. Okay. Yeah. So coming to peer educator program, again, it's comes under subcenter level. The CHOs or ANMs has to enter the data at 12.3 data element peer educator program. If the CHOs have confused to enter the data, the medical officer could enter the actual number of peer educators selected out of selected peer educator number trained, which means it's in a yearly once activity. If we select the peer educator for this year, the number will not change for the next year. For suppose one PSC is each subcenter have selected 15 to 20 peer educator, which means 20 into 5 subcenter. So 100. So here number of peer educators selected for PHC is 100. Out of selected peer educator number trained 100 for entire year. So if you enter for this month, like this year we have started with April. If you start like 100, April once activity, it's a yearly once activity, you need to enter only at April time only. May, June, July, August, you just enter 0. No need to enter 100 again. So ignore for next 26 April, March. So again, 26 April, you need to re-enter the data like it's maybe number may be high or number may be reduced as per your target population. Okay. So down 12.3.2 here, number of adolescent health and wellness days organized, club meetings organized. Here you can, simply put the number like number of sub-centers. How many sub-centers are there? Because as we know that health wellness days will be organized at a sub-center level once in a month, especially fourth Thursday of every month. Okay. So you need to just put the number, total number of sub-center in your facility, in your PSC. Okay. Just put your number. For urban health centers, so no need to enter any number because you don't have a sub-centers, but you can enter the number of number of times you can organize the health wellness days. So here you have a doubt like club meetings. What about club meetings? So there is a differentiation between health wellness days and club meeting. Health wellness days will be organizing with only students. Club meetings along with their parents. So if possible, we can enter the data, but I don't think so. Parents will not attend every time. So that is the reason I'm just mixing both the community-based intervention in a single task. Like you can enter that number of sub-centers in that 12.3.4 also. Okay. Yeah. So this is about the data elements, which is you need to enter at the PHC level, and whereas sub-center level, we have it the same data entry, but at PHC, at CHO or ANM level, they supposed to enter the MHS data, like number of sanitary napkin packs distributed by the ASHA. There is one option called. I will show you. Please wait. Yeah. So you can see the data elements under RKSK at subcenter level. Yeah. So there are only two data elements at subcenter level. That is comes under M11. That is adolescent health. We have a menstrual hygiene. So which is tomorrow you will be celebrating. So for that we have a separate data element called number of adolescent girls provided sanitary napkin packs by state UT supported menstrual hygiene scheme. So actually the 11.1.4 is the previous data element which we need to enter. But now we should ignore this data element and we should consider the 11.1.1, that is number of adolescent girls provided sanitary napkin packs by Asha. So this is the very important. So everybody please note this data element. There is an ambiguity on this issue. So kindly note this 11.1.1 number of adolescent girls. Let me mark this. I'll mark this one. Yeah. You can see that I will increase the widget side. Yeah. Yeah, I have highlighted that data element number of adolescent girls provided sanitary napkin packs by Asha. So in this data element, the Asha, sorry, is our CHO or ANM has to enter at a number reported during the month outreach activity. It is an outreach activity. They're supposed to enter in this field only. So is it clear? I hope everyone has got the knowledge on this data elements of HMIS about RKSK. So now final topic is about AFSC application. So as we know that AFSC, we have a district ranking for all the data, all the programs. So for RKSK, we have RKSK and family welfare, family planning. We have a we have a 5 marks. So in that, AFSC plays a very important role. Like we have a 2 marks for this uh, district rankings. That is AFSC. So adolescent friendly health clinic. As we know that every week Friday for girls, Saturday for boys, afternoon 2 to 4 p.m. You have to conduct the clinic for the adolescent. You need to provide clinical counseling referral services. Uh, Along with that, you need to enter the data of client load. As we know that target client load is 340 per month per clinic. So we need to achieve that data. If in order to achieve that data, we need to have a community-based interventions. We need to reach out all the adolescents in the community. So that is the reason we are insisting all the medical officers to conduct community-based interventions like health wellness days, any special days like menstrual hygiene day, tobacco day, all these days we can utilize this platform to encourage all the adolescents to participate in the special days and also utilize the platform like AFSS, which we are offering clinical counseling and referral services to all the adolescent girls and boys. Okay. So for this, Government of India has developed one application called AFSC app. I think all the MOs from the PHC rural and urban has trained by GOI. So it's a refreshment. So just we'll have a look over this application. So its application enables the iOS and Play Store as well. And here you can see in the iOS the icon of the AFSC. So these are the credentials. All the medical officer from the PHC and UPSC has got the credentials. If not, I will provide the this help desk number end of the slide. I will please note down that and you can ask directly to that help desk. Okay. So here you can have 4 icons in this application: client registration, outreach, my client, my services, service delivery, my AFSC achievements, and the reports. So under client registration, as we know that we have a registers. So in the registers, we have a demography of the individual. The difference between the HMIS and the application is HMIS only we are just putting the number and entering the number. Whereas in application and registers, we need to provide all the demographical and clinical data of the individual or adolescent. Okay, so this the data we need to capture in that application. It's a different mode like clinical. First, we need to register the client, and also we have to provide the services, like what type of services we have offered, whether it is a clinical or counseling or referral services, which we need to enter again. And the service outreach, we have in a different like micro plan and pre-plan, that is. So for that, we need to provide all the details of your area. And we have, yeah, it's also outreach activities. And we have a My IFSC. It's a My IFSC. It's like, as soon as you enter into that application, you need to add your facility name, like facility in charge name and a designation, service provider, so gender, everything you need to enter, and you can operate or you can utilize this application. Yeah. So yeah. So my clients, you can with a single click, you can, you can have a dashboard like number of clients during the month and number of, total follow-ups. It's an excellent application. We have excellent feedback from the age counselors, which they are using since months. And also, thankfully, a lot of medical officers also utilizing this, ISFC application. With this application, you can generate the monthly performance report in a single click. So this is very, very useful application. So I am requesting all the members to utilize this platform, enter all the details of adolescent at AFSC, which we are entering the data of AFSC and HMIS data should be similar. There should not be any discrepancy in the data. So if suppose the HMIS is showing that 200 per month per clinic, if you entering the data 100 in a AFS application, that should be big problem for us, identify where it is the lagging. So this should not be happen. The data which we are entering the AFS application and HMIS is to be similar. Okay, yeah. So this is about data synchronization. Though they have developed like, in offline data you can enter, and meanwhile when you get the data network, and it will be data will be synced automatically. So this is about logout. Yeah. So please note down this support framework, like they have provided help desk number, that is 08069762929. So you can WhatsApp your issue, like they have provided the WhatsApp number like 93194285569. And also you can email the content which, if you have any problem with any application for the logging or for log off, for entering the data and utilization, support@rksk.in. So this is about the AFSC application. So I'm requesting all the members, so kindly utilize this platform in order to generate a simple and easy MPR, and also, support support the RKSK team at which they are situated at different level at age counselors. So utilize this opportunity to enter all the data, so which should be similar at HMIS and also then application. Okay, so please note down this help desk number, WhatsApp number, and also the email ID. Any doubts so far? So I'm allowing one PHC, MO PHC, Duppalapalam. Any doubts? I'm trying to unmute Duppalapalam. Please speak up. MO PHC Duppalapalam. Please unmute and ask your question, since you have raised your hand. Dr. Navin, DPMO NTR. I can see 3 hands rising, but no one is.
Sir,
Yeah,
hello, sir.
Sir,
Could you please tell us the help desk number, sir, again? because we
Yeah,
couldn't get the display.
yeah. It's not displaying. I thought it is.
Yes, sir.
Yeah, 080
080
69
69
76
76
2929.
2929.
Yeah,
So
so
WhatsApp number is 3194285669.
yeah,
Support at the rate rksk.in.
yeah. So if you have any query related to AFS application, so please try to drop a mail to this email ID so that they can resolve the issue, because they have provided all the credential for who. Sorry, please mute yourself. Yeah. Yeah, so they have provided for who joined the meeting earlier. So it's, I think, 6 months back they have joined. So maybe the chances, if you utilize this service, like they have provided help desk number and email ID. So utilize this opportunity and take this AFSC credential from them again. And as I mentioned in the PPT, so mentioned your. Okay. Yeah. So in the PPT, I have mentioned that you need to enter your profile, AFSC profiling. Then you can start using this application. Okay. Yeah. Any doubts? MBO PSC Duppalapalem. You can unmute. Please, you can unmute and speak. Please, I can see so many hands. I am trying to allow you to talk. Yeah. From your side, you should unmute and speak and PO RBSK. I don't know where it is. Yeah.
Sir, can you please repeat the WhatsApp number?
Yeah, I'll share the PPT and no worries at all. I'll share the PPT. So, yeah, 9319
9319
42
42
8569.
3569
Sorry, 8569.
8569. Okay, thank you.
No worries. I'll share this PPT again in the group, and also I'll mail all the PPTs and the agendas to all the districts. No worries at all. So this AFS application is doing wonders in the field. So we have a very good positive feedback from all the counselors. So kindly utilize this platform. It's very, very, very simple. So very simple. So first you need to have a credential. If you don't have any credential, we will provide, with the help of help desk, with the help of WhatsApp number, with the help of RKSK at the rate support RKSK at the rate .in. So using these platforms you can get the credential, and once you get the credential you need to add profile, add your profile AFSC details, and then start. So if you have a counselor in your area, take the support of AFSC counselor. They will support you to enter in this application, and they will orient you again about the application. Okay. Yeah. So this is about the application, and so to summarize all, we have discussed about the program. It's a briefly introduction and the strategic intervention and the RKSK program, and the menstrual hygiene day, tomorrow's activity, what you need to perform. And again, I will repeat that. So try to provide a public information campaign, rallies, marches by the adolescent and other key stakeholders, whichever you have in the field. Engage with your public representatives in your area. Publicize the key information, the media, including social media, distribute IEC materials, which we have already distributed through WhatsApp and also through email. So again, I will share all the posters related to menstrual hygiene. So utilize that banner which we have already made previously. Just we need to change the date. That's it. And display posters, banners at pamphlets, places at different levels. Special counseling services at AFSCs, organize adolescent health and wellness days. Now we don't have schools. You can provide this health wellness days at your sub-center level, and the distribution of sanitary napkin packs to adolescent is possible if possible. If not, please ignore it. So engage through social media platforms such as Instagram, Facebook, and Twitter. So these are all activities which we need to perform tomorrow, and do not forget to share all the photographs. So take good photographs and share it within the groups. Okay. So next we have within 5 minutes the state program officer Dr. Glory ma'am will and want to interact with you. So please stay back.